I'm Dr. Allison. Thank you so much for joining me today. So I own Body Motion Physical Therapy. So we're here and then we're in Poulsbo as well. And essentially we help women through pregnancy, fertility, postpartum recovery, all the way through menopause so they can live active, fit, healthy lives. And truly, if you prep your bodies for delivery, you save your pelvic floor and you save your core, which in turn then allows you to have a very prosperous, healthy life, saving your joints. A lot of what I got into this, I'm going to spiel a little and ask me questions as we go. But I got into this because I saw so many women in their like 40s, 50s, and 60s, and they were having joint replacements and cortisone injections and all this stuff. And a lot of it was because they never rehabbed their core. They never got their core back after they had babies. So I started really working with people on their core and like doing prevention, like restoring their bodies after pregnancy. And I realized that there was a huge hole that we needed to help prepare people's bodies for the delivery process. If you don't prepare, it's like running a marathon without actually even training for the race. And that's what I see happen so frequently. And so I'm here to just give you all of this information. What we do here is called like our pregnancy support package. And it's all about body motion birth preparation protocols, which you're going to read a lot about in that book if you decide to read the book. And what we do is we help people have tear-free births. We help them not push for hours and hours and hours. And even first-time moms, like one of our providers this past weekend, she came here, obviously her whole pregnancy, worked through her pregnancy as well. And she just had her first baby, 9 pounds and 1 ounce, vaginally with no tearing at all, pushed for 20 minutes, didn't even push, just breathe baby out, which is what we're going to talk about learning how to do today. And it is just, we had 3 births this weekend, so I'm super high off our births because no one tore and they were magical experiences. And even if you do tear, but you condition your pelvic floor for birth, you heal so much better. If you think about like athletes, like football players, hockey players, whatever, if they tear their hamstring, they're going to be back on the field or on the ice within 6 to 8 weeks. Like it's a quick recovery. If our parents tear their hamstring, or someone who isn't very fit, maybe some of your parents are super fit, but like if someone who it doesn't move much tears their hamstring, they're going to be out for a year. They're probably not going to be walking for a year. And the same goes for your pelvic floor. And so there's a lot out there about exercises to do for birth and like prepping your pelvic floor for birth. And a lot of those like fitness programs and strength programs, a lot of those fitness and strength programs, they're great if you want to maintain your fitness during pregnancy, which is absolutely amazing. And, that's ideal. But the issue is that doesn't help with the birth outcome whatsoever. In fact, a lot of times when people work out so heavily during pregnancy, their pelvic floors tend to be tighter, which is why we don't teach Kegels during pregnancy. And if you are, depending on what kind of exercise program you're doing, it's so important to connect to your pelvic floor and gain length of your pelvic floor so that the baby can come through the birth canal if you're planning to have a vaginal delivery. Even if you're planning to have a cesarean birth, the stronger and more coordinated your pelvic floor is, the easier it is to recover your core postpartum. Slow me down, ask me questions. It's fun if this is interactive, so I would love for you to ask me questions. I talk fast and kind of a lot when I get excited, but I love teaching this stuff. I have 3 kids myself. I have a 9, 7, and 3-year-old, and they are also what helped me start this process. I was a pelvic PT for the last 15 years, so before I even had my kids, but I treated like a lot of pelvic PTs do for pregnancy and birth prep. And that's why we don't do that. And that's why we started the body motion birth prep protocols, because we really work on balancing the pelvis externally and balancing the pelvis internally to allow the pelvis to open so baby can come down. A lot of times what happens if we don't have connection to our pelvic floor tends to be tight and cement-like. And then the uterus, which is what actually pushes the baby out. So you don't actually have to push baby out. The uterus is the muscle that pushes the baby down and out, okay? So as long as your pelvic floor can open and expand, then the uterus, all it has to do is push baby out. If you've had babies, that's a lot of work. But if you can train your pelvic floor to relax and open, then all of a sudden you're gonna have a much better birthing experience. Baby will have less likelihood of getting stuck in the birth canal, less likelihood of having forceps or having to do a vacuum or anything like that. And that's why our C-section rates are so much lower. I think we're at 8% for this year, but that also includes breech babies where a lot of providers won't deliver vaginally breech babies. A breech baby is when they're upside down, so their booty would come out first. Okay, so I'm going to teach you guys all how to connect to your pelvic floor. And I'm also going to teach you a little bit of the changes that happen to your body during pregnancy. You're probably already experiencing them, but just knowing these changes will help you support these changes. And the more that we can support the changes through some breath work and some exercise, the better you are going to be at having a more relaxed pelvic floor. So we want to avoid pains. That's why on the quiz, it's like if you have SI pain or low back pain, or if you have incontinence, a lot of times it just means that your pelvic floor is tight and not working for you in the way that it should. So yes, we're going to go through that. We're going to go through some boring body mechanics stuff. But the reason I want to teach it to you is because if you can keep your body safe again during this pregnancy and when your joints are changing, then you're going to have a less tightened pelvic floor, which is going to lead to baby getting through a lot easier. Women in general tend to have very contracted and tight pelvic floors because no one teaches us how to connect to our pelvic floors. And you might be like, but a tight pelvic floor is a good pelvic floor. Not necessarily. We need the muscle to be really dynamic. So this is the pelvic floor. There's 3 holes that go through it. We have the anus where we poop out of. We have the vagina for anything penetrative, and then of course childbirth. We have the urethra where we pee out of, and then we have clitoris here. They're all controlled by this bowl of muscles called the pelvic floor. There's 3 different layers. There's this first layer. There's a second layer that's more fascial, and there's a third deep layer here. And all of these muscles create what's called the pelvic floor. If you tear during childbirth, you usually tear through this first layer, and then they'll do stitches typically, and that's where the scar tissue will lie. The reason we like to avoid tearing is so we don't get scar tissue. The more scar tissue you get during childbirth, the more tightened the pelvic floor becomes, because the body, scar tissue is amazing. It's a compensation that the body uses to create more structure. But when we get that structure, we lose the movement of the pelvic floor. All right, I'm hardly with myself. I feel like I'm talking very fast. But the pelvic floor is this dynamic mover, okay? So if pretend it's like the bicep, it contracts, it relaxes, and it overstretches. It has to overstretch for you to poop, for you to fart, and we need that overstretch, of course, to deliver babies. If we don't have that overstretch, we're more susceptible to things like hemorrhoids, anal fissures, tearing during childbirth, or the baby not getting through birth canal with as much ease because we can't overstretch and overextend. So I was saying that women tend to have very tight and contracted pelvic floors just because we have no connection to them. Ideally, this would be taught in like 5th grade flash class. I don't know if do you guys have that flash? Yeah, no, it's like I grew up in Seattle, like Seattle Public Schools, and so it's like where they taught us all about sex. Mm-hmm. And they should have taught us how to pee and poop, and they can still teach us about the condoms then, but like they need to teach us how to pee and poop because a lot of us don't know how, and we're going to actually go through how to pee and poop and this day moving forward till you deliver and beyond, and how you will teach your children to pee and poop is what you're going to learn today. So even if you can't like translate it into the delivery room, you're going to learn how to pee and poop effectively and save your organs and save from falling out and save your bodies. So we're going to talk about that because if you can pee and poop appropriately, then you'll be able to open and relax so baby can slide out of birth canal. So some changes that happen in the body during pregnancy are, first off, our rib cages start to get wider. Okay. So the muscle, has anyone experienced this yet? Bras change size? No?
Yeah.
Okay. Yeah. Okay. My ribs are still like returning back. I was actually just looking in the mirror and I was like, oh, I need to work on that a little more. Mm-hmm. So rib cage expands, okay? And the diaphragm is this dome-shaped muscle and it sits under the rib cage, okay? So it should descend when you inhale. So if you take a deep breath with me. When we inhale into our bellies, and let the belly expand. Just let the air move into the belly. Don't force it. Just feel that air opening and expanding into belly. And exhale. Let it go. You can put a hand on your chest and a hand on your belly. And I want you to try not to let the air go into the chest. And just try to have the air move into the belly. Take a nice deep breath into the belly. So you're going to breathe in the belly. Not let the hand move here. Exhale and let it go. That is a diaphragmatic breath. That is like a yoga style breath. And what that's doing is it's conditioning your diaphragm to drop into your belly. What then also happens is that the pelvic floor then opens and drops open. And we're going to connect to that in just a minute. But what you need to know is that the length of the diaphragm gets longer when you're pregnant, so it gets weaker. So you want to work on this every single day, 5 minutes a day, just simple belly breathing. And then this is going to be the breath that you want to use the minute you start getting contractions. And you need to lock into this breath for hopefully 8 hours, maybe 24, maybe 48, okay? And this is the type of breathing that you'll use to help drive baby down into the birth canal, which is gonna help open the cervix, and then also it's gonna keep elongating the pelvic floor. I'm gonna review this multiple times so we can talk through it and we can practice together. But the reason we wanna use that diaphragmatic breath 5 minutes every day is because the diaphragm gets weaker because of the length that it changes during pregnancy. So you've got to keep using it. You might see things on social media that are like, oh, do like more rib breathing or Pilates style breathing. And that's where you're breathing more into the rib cages laterally or into the back. So if you like put your hands on your ribs here and then you take a nice deep breath into your ribs, your hands, take a nice deep breath here. And then exhale and let it go. So that is called an intercostal breath. And when we move the air there, it doesn't allow the diaphragm to descend down into the belly as much, which then doesn't allow the pelvic floor to open as much. So if you see stuff like, oh, breathe 360, like 360 degree breathing, yes, that can be great, but I would caution you to really focus, especially during the pregnancy and prepping for the delivery itself, to breathe into the belly, because that's going to be, we want the diaphragm driving as low as possible. And when we drive the air more here, you just get, yes, the diaphragm's expanding, but it's not dropping down onto the top of the uterus. Does that make sense? And we secretly want this diaphragm to help push baby down on the top of the uterus, so during contractions. So the more we train it now, the better that's going to happen during the childbirth experience. Another thing that happens is that the abs get elongated. So one of the things that happens is people get diastasis recti, where the abs will split open and you'll start to feel like you can kind of feel a hole between your abs, or maybe your belly button like kind of starts to come out and you're like, is that organs that I see? Like it starts to look weird. So everyone's going to get some degree of separation. It's not clinically significant or worrisome if it's like 2 centimeters or less or 2 finger widths apart, but we want it to be as not palpable as possible. So you don't want to have it. If we ultrasound everyone at 40 weeks pregnant, we're going to see it. 38 to 40 weeks pregnant. That's what the research says. But a lot of times clinically, you don't notice it unless it's significant. So you get a bigger separation, and then that makes it harder for the abs to come back together after delivery. So one of the things, why don't we all stand up and do this together? One of the things that you can do, and this is in the book too, is called a transverse abdominis contraction. So that is, your transverse abdominis is the front of your core. Bottom of the core is pelvic floor. The top is the diaphragm. The front is your transverse abdominis, your 6-pack abs, your obliques. Do you guys feel that happening in your bodies? Okay. That is contracting your lower abdominal muscle. Hold that 10 seconds, 10 times every day. So you just bust out 10 seconds, 10 times. And that's going to help prevent that diastasis recti. Because the abs get so long, especially as you get bigger, the more you can train that muscle to stay active, the better it's going to be. The better it's going to function. The better it functions, the less tight your pelvic floor is going to be. So we want it functioning for you. You don't have to walk around like squeezing it, not all the time, because that's also probably for most people going to squeeze their pelvic floors. We want that not to be the same, but it just as a good practice, 10 seconds, 10 times. And if you're going to think like, I'm going to do this before I fall asleep, and then I'll do my 5 minutes of breathing, follow the breathing with it. So you know you're relaxing at the very end. So those are a couple of the changes. Other changes that happen is that the pelvis right here at the pubic symphysis joint starts to separate. We get about 5 to 9 during the actual labor experience, but 5 to 7 during pregnancy, but up to 9 during the actual delivery of separation here. And that actually doesn't just automatically go back postpartum. I've seen people with x-rays at like 6 to 12 weeks and they still have a significant separation here, which is why it's important to ease back into fitness and exercise routine. But what happens when our pelvises start to spread, which is we want that to happen, okay, and we need that to happen, is the pelvic floor tends to get tighter because it's trying to provide stability and keep that joint together so that it doesn't become painful and you don't get what's called pubic symphysis pain. So pain right in that joint. Hopefully no one's experiencing that here, but that is not comfortable and can get worse during childbirth. And it's hard if you have pain in that joint, you want to get it treated right away, and not just so you can relax the pelvic floor, but so baby can come through birth canal and you can spread your legs. A lot of times when people go into childbirth with that excruciating pain, it's hard to want to spread your legs with that kind of pain. So that was just my side note in case that happens to you at any point along the way. But so that's what will happen during pregnancy. Because of relaxin and progesterone, they increase the joint separation, not just here on the SI joints, but also like in your knees and your feet. So the feet expand. If you're having any foot pain, I have a whole chapter on feet. So, or if your feet are changing sizes, read the foot chapter because there's some exercises to help you keep your feet in alignment and keep your feet strong. But those are the changes that can happen during pregnancy, along with a slew of others, but we're going to focus on those. Questions?
Is the separation of that pain, is that what people, I've seen it like online, like, is that the same as lightning crotch?
Yeah. And so lightning crotch can be two things, but it can be that, or it can be spasms of the pelvic floor where it feels like there's like a knife actually inside your vagina. And those would be spasms of the pelvic floor. The diagnosis for that is called proctological food jabs. If you have it, there's a chapter on that. So there's a lot of, I put the book together because there's a lot of self-treatment, and it's just really important, like, to support your body as much as you can for childbirth. And then let's dive in now. I'm going to skip to prepping our pelvic floor for birth. Pretty much my non-negotiable, and I wish we could give this to the entire world, is to do body motion pregnancy protocols for prepping the pelvic floor for birth, because it is just, I could tell you birth story after birth story after birth story, how important internal and external balancing work of these muscles is extremely important. Because today I'm going to teach you how to breathe and connect to these muscles, but to truly change the lengths of them is a whole nother story. And if you have a hard time like connecting to what I'm talking about today, it would be all the more reason to at least get an assessment of what this looks like in your body. But I'm going to teach you how to do it. Even if you can't feel it here, I'm going to teach you how to like kind of start to feel it at home too. So we talked about the diaphragmatic breath, right? So when diaphragm opens and pushes down, what should also be happening is that the pelvic floor should open. If you guys sit on your chairs, I'm going to have you uncross your legs. Actually, stand up. Everybody stand up. So this is how you want to sit for the rest of your pregnancy in your chairs. It doesn't matter if you have a $5,000 chair or a $5 chair, because it's how we sit on those chairs that matter. When you go to sit down, you want your feet fist width apart, maybe a little further, depending on how you're carrying, really. And then as you go to sit down, you're going to lift one butt cheek. Then you're going to lift the other butt cheek. You're going to reach your butt back and sit on your sit bones. And I want you to feel your sit bones. Now, these chairs, I don't think all of them have pillows behind you, but this is how you would sit at your house or at your work chair or wherever you are. And then you want to be supported in the back. So you could just stick a pillow in there. And then you should feel like you don't have to like hold this up. You should feel like you can let your body relax on those sit bones. Sitting like this is going to allow the pelvic floor not to do so much work. The minute we go into like this slouched position, all of a sudden your pelvic floor is going to contract hard. And we don't want that to happen. So stay sitting on your sit bones, even if you don't have a back support right now. And I want you to take a nice deep breath into your belly. So feel that happen again. So feel that air go into the belly. Exhale and let it go. And then I want you to connect down to your vagina. Imagine your vagina opening on the inhale. So if your vagina was a rosebud, you would feel all the petals of the flower blossom on the inhale. So you're going to inhale, blossom the petals. You want to see all the petals. Exhale. You're going to feel some recoil. Let's do that again. Inhale into belly. We should feel the opening. Exhale and let it go. If you have a hard time feeling that, let's connect down to the anus. So obviously baby's not going to come through anus, but I want you to connect to anus and see if you have better connection mentally there. So connect to your anus. You're going to inhale and open, like you're flaring your anus open, totally safe space to fart. Don't be mad at your neighbor. We're all doing this together. Exhale and let it go. Inhale and open. And exhale and let it go. If you are like, I have no idea what this lady is talking about, a couple things you can do. One, if you feel comfortable touching your own body at home, you can go home and just put a finger right inside the vagina or right outside the vagina and do this type of breathing. See if you can feel that opening. Because if you can't feel this opening now, it's going to be so hard to feel or get that opening in the delivery room. And when you are pushing baby out, a lot of times you're just using abdominal pressure. And if you have no control of that opening, then you're going to be pushing for a long, long, long time. And we want to get this opening so good. And we want it to move so well with your breath. And we want it to overextend. And that's why getting pelvic work done is so vital, because it can get that muscle to that overextended state and like get it prepared for that. But then it allows your brain to connect to it. So a lot of our birth preparation protocols is all about like connecting your brain to the work that's happening in your body. So then that gives you even extra control of what that looks like. But regardless, practice this breathing. So when you're doing the 5 minutes a day, connect that breath to the pelvic floor as well. So you're just taking it a step farther. You don't have to do 5 and 5. Tie it all together, super efficient, and just do that type of breathing. Does that make sense? Okay, so that's going to help to start condition the pelvic floor to get that overextension that you're going to need so the uterus can just push baby out and you don't have to do the hard work. So your pelvic floor, so you're not pushing and pushing and pushing. My first 2 births, I was a pelvic floor PT, so I did everything for the pelvic floor except the balancing and internal work that I couldn't do myself. And it was so much to my detriment, because I pushed for, I think, 4 hours for my first, 3 hours for my second. It's all in the book, the exact times. And I had massive tearing and I had severe, severe prolapse, because when you're pushing for hours, you're not just pushing your baby out. The uterus is pushing. You're not just adding pressure to the uterus, you are adding pressure to your bladder, to your rectum, and everything like that. So we want to avoid that type of like volitional breath holding pushing, because if we're doing that, we're pushing our organs out. I truly believe this is why all of these women in the nursing homes are peeing their pants and in diapers, is because they all have pelvic organ prolapse and they have no control of their bladders by the time they get to their 70s and 80s. Really, they probably have no control starting in their 40s. But you just compensate, right, and deal with it. But it also means that your pelvic floor is not working for you. So that was a total sidetrack. Just selling, like, take care of your internal workings. It's not as sexy as Botox, but it is so worth it. Because we can prevent so much when we get to our 40s, 50s, and 60s. So let's do this. We're going to do another exercise together. We're going to go into how to have a healthy bowel movement. The more that you poop like this, the less pressure you're going to put on your organs coming out of your body, and also the more control that you're going to have of your pelvic floor. And if you poop like this, and every time you poop from here on out, you pretend and visualize that it's actually your baby's head coming through your birth canal, then you're going to start to pattern that sensation, and your body's going to be like, okay, that's a safe sensation. This is what should be happening. And the more you repeat that in your brain, the more your body's like, oh, it's not going to be scared and tighten up when you're in that delivery process. This is another reason why pelvic work is so important, is because you start to train the muscles, and then you're like, that sensation is safe. Okay, this is okay. This is exactly what should be happening. This is a good thing. And so then it allows you to stay in that more relaxed state. Okay, when you get the urge to have a bowel movement, then you should go within 15 minutes. And I know a lot of us like work, and maybe you treat patients, or maybe you are, it's hard, maybe you teach and it's hard to do that. But the more that you can really listen to those cues, and when your body tells you to poop, you go poop, the better. The more we ignore our poop urges, the more impaction we get of the colon, of the descending colon and the sigmoid colon. And so it stretches out and we lose our reflex that tells the brain I'm full. And it's really easy to lose that reflex. So try to listen to it as best as you can. We want to avoid constipation. Constipation during pregnancy is only going to add pressure to the uterus. It's going to add pressure to the bladder. Imagine like this is my bladder. Here's the uterus on top of the bladder, and then back here is the rectum. If this is full of poop, it's going to put so much more pressure down on these organs, which is then going to hemorrhoids, fissures, but also pelvic organ prolapse. Pelvic organ prolapse, when I say this, it just means that the organs start to descend outside of our bodies. Men, they get to keep their organs hanging out, right? We don't get that luxury. So we have to, for the rest of our lives, keep them inside our body. And having a tight pelvic floor actually makes it harder to keep the organs inside the body. Okay, this is why we are an anti-Kegel clinic here. We do not believe in Kegels because of the fact that if your pelvic floor is this bowl, and imagine my bladder is a grape, okay, a little grape. Here's my bowl. The tighter my bowl, my pelvic floor, the more it's going to squeeze on that grape and push that grape down and squish the grape. The more it's open and at a normal length, the easier it is for the grape to just be in its place, for my bladder and my uterus and my rectum to all be in its places. So that's why we don't want this like super tight pelvic floor. Inevitably, someone's going to ask me or think this in your brains, but my husband wants me to have a tight pelvic floor. And I will tell you that, or my partner, whatever, I will tell you that a pelvic floor that is able to eccentrically elongate and has this flexibility feels 10 times better for you and your partner because it all of a sudden has blood flow. Pelvic floors that are tight and contracted, they turn, this is a food analogy and not vegan friendly. So close your ears if you can't handle that. That's my fair warning. But the pelvic floors that are contracted and tight, they turn into beef jerky texture. That's going to tear a lot easier if baby tries to come through birth canal. Pelvic floors that have blood flow and can open and elongate, they're like a juicy chicken breast or like a steak, not a fibrous steak, but like a nice steak. And that's what we want the muscle quality to be. And that's what we work to turn the muscles into. And that feels so much better for sex. And you want that for sex for your life. Like you don't want, so someone usually asks me about that. That's why I like to just say it. Because a lot of people think it. You're like, I want a tight pelvic floor. Like, of course I want it. But no, you want just a healthy, beefy pelvic floor is what you want. Because then it's easier for baby to slide through birth canal. And it's way more pleasurable. Also, you get better lubrication, which is also better for pleasure. So there's that. Questions? That was my side note. And I didn't even talk about bowel movements yet. So bowel movements is really how we're going to breathe the baby out. But we're just breathing poop out to start. Okay? So we get our urge. Within 15 minutes, we go and sit on the toilet. If you can tolerate a squatty potty or a stool, that's where your knees come above your hips. That's a great position. If that's an uncomfortable position for your body, it's not a good position for you. If you're uncomfortable at all when you're pooping or in any spot, that you can guarantee, I almost said bet your bottom dollar, but that your pelvic floor is super tight in that position. So you want to feel good in whatever position it is. If you don't have a stool or a squatty potty, you can simply just lean forward. But again, if this doesn't feel good on your body, don't do it. So just like take what advice feels good from me. And if it doesn't work for your body, that's not a bad thing or anything like that. The reason we like to bend forward or use the squatty potty is because it takes what's called your anorectal angle, which is just a fancy part of the colon, and it straightens the chute. Okay? So this is true for bowel movements, not for vaginal delivery. Okay, so just know that that's very different. So when we go to poop, we're in this position, and you guys can get in this position with me if you want. And you'll just practice. You're going to do 3 diaphragmatic breaths where we deep breath into belly, and we try not to let the air go into the chest. So take a nice deep breath into the belly. When you inhale next, I want you to think about opening your anus, opening your vagina on the inhale. And exhale and let it go. And if the poop hasn't come out by the top of the 3rd inhale, then at the top of the 3rd inhale, when you inhale and open, you can bear down and lengthen your pelvic floor. It's not an aggressive like push. This is just a lengthening. It's like a fart that you want to pass, but you don't want anyone to see you fart. It's like the smallest little opening. That would be your poop. It takes serious dedication to start pooping like this. especially if you're in a hurry or if you have little ones running around. Like, it's hard to be like, I'm gonna sit on the toilet and breathe my poop out, but it literally only takes like 20 extra seconds, and it will save your organs. And if you can start to train your brain to breathe the poop out, you're gonna train your brain to breathe the baby out. Make sense?
Mm-hmm.
Okay. What else should I say? A couple things. If your poop is hard and you're constipated, get unconstipated as quickly as possible. Come in here and get unconstipated. We will help you. If you are constipated, because you just don't want that extra pressure on the uterus and on the bladder, it's just a lot more work for your body. Also, you want to avoid hemorrhoids and anal fissures at all costs, especially before the delivery. If you are constipated, consider supplements like this. Of course, talk to your providers about this because everybody's bodies are so different, and maybe you're already on medications or you're high risk. But magnesium is an amazing supplement, magnesium citrate. I used to call them magnesium, and I love that for pregnancy. There's tons of research on magnesium and decreased or improved APGAR scores in babies and decreased time spent in the NICU. But for some reason, it's the cheapest supplement on earth, so we actually don't tell people this. But everyone should honestly be taking magnesium during pregnancy if it's safe for their bodies. It might be different if you have blood pressure disorders or any other thing going on, so definitely talk to your providers. But magnesium is an amazing supplement, since I'm talking, so bowel movement wise for that. Also helps with sleep. A couple other supplements that you should consider talking to your providers about, because we've seen such an uptick lately in postpartum fractures, is everyone should be on the calcium. And because a lot of times, if you plan to lactate, but even just from pregnancy itself, we can decrease our bone density. So make sure that you're taking a calcium. Calcium usually has to be paired with vitamin D and K, but you want to talk to your providers about adding a calcium on top of your prenatal. And then my other thing is that 80% of women in their third trimester are protein deficient. If you go into your third trimester protein deficient, it makes it a lot harder to recover postpartum. So we want to make sure, I know I always had meat aversions in every single pregnancy, but beans and protein powders and Ninja Creamy is my jam. If you don't have a Ninja Creamy, because I'm just, I'm not sponsored by them. I wish I was. But yeah, just like any kind of like making sure you're getting enough grams of protein. Recommended amount is fairly low during pregnancy. It's like 70 grams, but a lot of times you can talk to your provider about what's good for your body. Sometimes it's 100, sometimes it's whatever your lean mass is. So you can estimate that with your providers. Those are my side notes on just like taking care generally of your nutrition in that regard and supplementation, because we can get so deficient during pregnancy, and it'll make all your muscles better and healthier. So that's where the bowel movement talk led. Yes.
Another question.
Yeah.
Regarding constipation,
Yes.
is it safe and appropriate to do like a visceral massage or like
Yeah,
a colon massage?
that's a
to
great
help
question.
With that? Or
we don't.
Okay.
Yeah, we don't, because so
Mhm.
she's asking if it's like safe to do a colon massage during pregnancy.
Mhm.
And I love colon massage. So colon massage, do this postpartum. You start down here at your cecum. You do a little circular motion. You work your way around your colon. I think this is in our postpartum online program or something.
Mm.
But and that's call it a colon massage. Super good to get the peristalsis back and moving normally. The reason we don't do it during pregnancy is just because of that. So it's covered in peritoneum. So it's the fascia that covers it. And it's just very connected to the uterine endopelvic fascia. So it's not something we like, I can't say sit here and do it. Now, would I crank on my own colon from the back? Probably when I was pregnant.
Yeah.
But it's not something that we like really teach or suggest, just because of how close it is to uterus and what it's encased in.
Makes sense.
So good question.
Everything's
though.
connected. Right?
Yes.
So yeah.
Cool. Thank you. For visceral motility during pregnancy, just doing some like nice side stretching is great. Doing some hip flexor opening is really good. I think that's in the book. But those would be my two go-to if you are having constipation issues. Cool. Peeing really quick. Perineal massage is massage of the first layer of the pelvic floor. Does it help? Well, it's not harmful. The research says that it doesn't help, but research is terrible. And so, I mean, it has its place, okay? But like, they hardly even look at female bodies, so they definitely like barely look at pregnancy. And so, it affects the first layer. response typically in office is essentially we will do some of that work for you, but it's almost irrelevant. To truly like allow baby to come down through birth canal, you want to be working these third layers. This is where most of the tension lies. So if you can get this opening, a lot of times the first and second layers will just follow that opening. But you can do perineal stretching. Perineal stretching on your own. You could stick a thumb in your vagina and go, it's called Thessley's massage, where you just like rub the perineum. If you're like this much of your thumb would be inside the vagina, and you're just essentially rubbing for a few minutes. The research fluctuates between, is it 32 weeks or 36 weeks, whatever. But, or you can just like pull and hold and stretch, feel a burn, and then let it go. But again, is it helpful? It's not going to be harmful. And it could help improve some of the blood flow in that first layer. So that's where it could be good. I really find that it's almost irrelevant is if these muscles are so tight. If these muscles are so tight, what happens to the vaginal canal is that the vaginal canal, so I'm going to be graphic for you. As a provider, this is how I can tell it. And so when you insert a finger into the vagina, you want this to be a straight shoot. Okay, so I want to feel that the first layer, the second layer, and the third layer are pretty much on the same plane. And when I have to go in and I feel like I have to go up to the third layer to get that third layer to come down, then the baby, to get through the birth canal, then has to work through that kink. Okay, so we want to avoid that. We want that opening to be there so that the muscles can just naturally be open there. Again, the problem is like we just spend so much of our life in that contracted state, so our muscles freeze in that state, and then you have women pushing for hours because they're pushing against cement walls. And it's just because we never got that mobility. If you're in a high stress environment, which, like, let's be real, pregnancy is stressful no matter how you slice it. Like, it's a completely stressful experience. I hope that's not your experience. It was mine every time, right? Like, you're just planning every aspect of your life, and there's aspects of stress. When our bodies are in any type of fight or flight mode, then our pelvic floors are contracted. And so the other benefit of doing this type of diaphragmatic breathing is it stimulates what's called your vagus nerve. Your vagus nerve is going to keep you in this rest and digest, relax mode. When our clients come in and we're seeing them at the end of pregnancy, usually on a weekly basis by the end, we say, like, if it's possible, take a week off before you deliver. Like, try not to work up to your due date. And the reason for that is because we want their bodies to naturally go into this rest and digest state. And when we're checking emails or we're checking in with work, our bodies are more revved up. We're in that fight or flight. We're in that, like, the modern day, the tiger is chasing us. If a tiger is chasing you, you're not delivering a baby vaginally. Our bodies know better than that. But a lot of times, like, the modern day fear and stress isn't as clear cut, right, as what it would be back in the wild. Yeah.
So in your diaphragmatic breath,
Yeah.
you mentioned that you inhale and that's when you open your vagina.
Yes.
But a lot of times when we are pushing, like we exhale during pushing. I don't know, like that's what I'm supposed to do.
Yeah, let's walk through it together. So we're going to go through that. So ideally, what happens when you're in labor, if you're having a free birth, you listen to your body. If you're in a forest with no medical professionals, and you wait until you have the deepest urge to have the most excruciating bowel movement that you cannot keep in your body, that's when you know baby's coming through birth canal. You are not consciously thinking of, like, I'm 10 centimeters dilated. You just get this intense feeling that you are going to have a bowel movement and you can't hold this bowel movement in. Okay? If you are birthing in a hospital, use that. Know that is when you are ready to push. Okay? If you are in a hospital, and even if you have an epidural, still use that as your barometer and fight for that. Tell your partners who are supporting you that's what you're aiming for. Because when you're 10 centimeters dilated and fully effaced, when you're ready to push, you might not have that intense urge to poop. And the reason is the baby's not fully down. Like, it's just not there. And this is epidural, no epidural. It doesn't matter. We want to make sure that baby is ready and low. And that's how we're going to effectively breathe baby out and not spend hours and hours of just pushing and gritting our teeth and wasting all this precious energy when we're fully effaced and 10 centimeters dilated. Okay. So, that's a self-advocacy thing. Everything you're learning here, like, just know that this isn't necessarily standard. I teach at Swedish once every quarter, and I do this. Come in. I'm like running over.
So fine. I'm just gonna
Sorry.
crash the presentation.
And what I teach there is we try to change the paradigm for the nurses, to really be able to not cue people to like push when they're not ready, and we really try to talk about breathing baby out, because a lot of times the coaching that you're going to get in a hospital setting anywhere really is going to be to hold your breath and push, right? And a lot of times they're not saying exhale and push. A lot of times they're saying inhale, get all the air in there, and then hold your breath and push for 10 minutes or 10 seconds. And that's a lot of pressure and a lot of force. And if you're not ready to push, you're going to be doing that for a long time. So we tend to not train that way, and we try to tell the nurses to train that way. And every single time I teach there, I taught there on the last week or something, and every single time it comes up, but the OBs are going to tell them to do that if we don't, and it's like, then this is a conversation you start having when they come into your delivery room. This is a conversation. This is how you can support them. And a lot of people don't know how to breathe into their diaphragm. Nonetheless, they don't know how to open their pelvic floors. So, the more educated that you go into your birth experience, and the more you're like, no, I want to breathe my baby out, the easier that it's going to be for teach your partners this so that they can support that. We had Dr. Katrina deliver. She's our director here at this clinic. She delivered last September. And her baby, she actually just shared her birth story on Instagram today. And her baby, she was being cute. She was induced. She was being cute. They were screaming at her, hold your breath and push. But like, we trained her here, like, she knew the protocol. She knew to breathe and connect to her pelvic floor. She knew her pelvic floor could do that work and really just get baby out herself. So she had to like exit out the nurses that were yelling at her during her birth experience. And she just had to go internal and be like, no, I'm breathing baby out. Like, I don't care what you're telling me. But that's like, she's a doctor, like, and she's trained here, And so it's that kind of, I'm just telling you this because you have to be your own advocate, and it doesn't matter if you're a doctor or not. It doesn't matter. You just have to be your own advocate of your own body. And that's really hard to do when you haven't gone through this experience yourself. That's why I'm proud of you for being here, because the more you can learn about your body, the better and more empowered in your experience is going to be, because you can create that experience. If you read my book, it's all about that. And so I give you that book so you can have, hopefully, so you can feel more empowered, and advocate for yourself in the birth room. Questions? I got off topic. Yeah.
Sorry to backtrack, but with
Yeah.
the perineal massage
Yes.
from earlier,
Yeah.
can you use a pelvic wand to get to that third layer, or is that still not like long enough
You
to reach?
can. It's not even FDA approved. What's it called? Oh man, I'm gonna forget the name. We tend to not educate on pelvic wand usage during pregnancy,
okay.
because we don't want anything. It's hard if you've used a pelvic wand. It's hard, even as a pelvic floor therapist, to know exactly where you are, and we don't do anything near cervix. And so we don't say foreign objects other than usually your partner, as long as you're not on pelvic rest, or knowing where our hands are on these muscles,
Gotcha.
because we don't touch cervix or go around any of the cervical ligaments. And sometimes if you have a wand in there, it's hard to know what you're exactly pulling on.
Gotcha. Okay.
Yeah.
No, that makes sense.
So,
Yeah.
Um,
But if you were pregnant, then you can get to those third layers
by yourself?
with a wand, or by yourself, or no?
No,
usually
you
have to-
can. Yeah,
Okay.
and you could do the postpartum, but
Okay.
we just would never say that with
With pregnancy.
pregnancy. And then sometimes the Epino. Sometimes people ask me, like, is the Epino? It's something that's approved in the UK. You can only get it from the UK, and it's where you insert it into the vagina, and it helps open up the muscles. But what we find is that it's just because we've had clients that will use them, but it's just not. It doesn't pinpoint where tension is in these muscles, so it doesn't create new length of these muscles. So yes, it might give you the brain sensation. Okay, I can feel that third layer opening, but it's not going to give you the actual like treatment of like getting these muscles open and changing the length of the muscles. It's also not approved FDA in the US, so I can't like tell you to do that. But let's talk before I lose it. We're not getting to body mechanics, I'm sorry, but maybe whoever wins the online program will have that section. Maybe we can send it to all of you. I don't know. But let's talk about breathing baby out. So you get to 10 centimeters dilated, fully effaced, but really you just have that deep, deep, deep urge to push baby out. And so when you get to that phase, then you're going to keep using your breath. The minute you start getting even Braxton Hicks contractions, start this type of breathing because it's going to stimulate the vagus nerve to keep you in that rest and digest, relax. I can have a baby mode. But it's also going to help you start driving the diaphragm down on top of the uterus, which is going to make your uterine contractions that much more effective because it's helping open up birth canal, and open up cervix. And yes, I think Teresa's back there.
Oh, she knows how.
Is Teresa back there?
I'll look.
Yeah. Okay. Sorry. My good. Breathing. So we're breathing baby out. And so now we have that deep urge to push and you're keeping that breath pattern. So deep breath into belly, pelvic floor is opening. Exhale and let it go. Try to keep your pelvic floor open. Again, if you're not feeling this, work on that at home. Like try to get this opening, try to get this brain connection to vagina if you can. That's what's going to help you do this type of breathing. Then let's say that you have to add some volitional pushing or you're starting to feel the stretch and you want to add some volitional pushing. What that's going to look like is you're going to inhale into belly. Belly's going to be hard. At the top of the inhale, you want to do this with a contraction. At the top of the inhale, you're going to keep your throat open. And at the top of the inhale, you'll initiate the push because everything is full and you'll begin your exhale. But you can maintain that opening and push phase. Okay? We also teach something called open glottis pushing. You'll read about it in the book. And what that is where your pelvic floor is very connected on this whole line to your digestive tract, including your throat. If you talk in a super high-pitched voice, your pelvic floor is going to narrow and your vocal folds are going to narrow, okay? That's why a lot of times in labor, they'll say, do deep sounds or opening sounds. And when you do that, like when you drive home tonight, if you're by yourself, just like bust out some music and start singing and like hit some high notes and see if you feel it elevate. Like, can you feel the Kegel almost? Like with Twinkle Twinkle, which I'll sing tonight to my baby, my 3-year-old. She's my ex. But then, and so you want to avoid that during labor, but also really truly when you're pushing. So you want those sounds to be deep. When you come to the office, we will put you in different positions to see where you have the best control. And then we also figure out what your sounds are. And you can figure out what your sounds are at home. Where do you feel you have the most opening? Is it like a grrr sound or is it a moo sound? Like you start to play with these. I know it sounds silly, but like it won't be in a few months. You guys and so those are the kind of sounds you want to play with the opening. That makes sense? So, baby's pushing out. We're using that type of breath pattern if we're having to use some volitional pushing. Cool? Your uterus can do the job if your pelvic floor can just open. And that's all you have to do.